Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications, and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs, since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone,
Em có hút thuốc lá không?
Có một ít.
Nhưng mà cũng có đúng không?
Yeah.
Cô suy xét ở đây chị. Lưng có bị không Vương?
Không có gì.
Hồi nãy em mới nhắn tin đây đúng không?
Dạ.
Em mụn ẩn nhiều lắm luôn á Vương. Em ở gần đây không?
Nhớ quận 3.
Welcome, and take a moment to breathe deeply. Let yourself relax into this peaceful space where we'll explore chemical exfoliation. specifically AHAs and BHAs. The word chemical can sound scary, and acid might make you nervous, but chemical exfoliation, when done correctly, is one of the gentlest and most effective ways to reveal brighter, smoother, healthier skin. There's nothing to fear here, only understanding to gain. Let's begin by understanding what exfoliation is and why your skin needs it. Your skin naturally sheds dead skin cells in a process called desquamation. Every minute of every day, you're losing thousands of dead cells from your skin's surface. This is normal, healthy, and necessary. These dead cells are replaced by fresh, new cells that travel up from deeper layers. When you're young, this process happens efficiently. Dead cells shed easily and your skin looks fresh and radiant. But as you age, or when various factors interfere, this natural shedding process slows down. Dead cells accumulate on your skin's surface, creating a dull, rough texture. Pores can become clogged. Your skin may look tired and lackluster. Exfoliation helps remove these accumulated dead cells, revealing the fresher, brighter skin underneath and encouraging your skin to maintain that healthy cell turnover. There are two main types of exfoliation: physical and chemical. Physical exfoliation uses scrubbing particles or tools to manually remove dead cells. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead cells, allowing them to shed naturally. Today we're focusing on chemical exfoliation, specifically the two main categories, AHAs and BHAs. Let's start with AHAs, alpha hydroxy acids. AHAs are water-soluble acids derived from various natural sources. The most common AHAs in skincare are glycolic acid from sugarcane, lactic acid from milk, and mandelic acid from almonds. Each has slightly different properties, but all work on the surface of your skin. AHAs work by weakening the bonds that hold dead skin cells together on your skin's surface. Think of it like dissolving the glue that's keeping those cells stuck. Once the bonds weaken, the dead cells can shed away naturally, revealing the fresh skin underneath. This surface exfoliation brings multiple benefits. First, it improves skin texture. As dead cells are removed, your skin becomes smoother, softer, and more even. Rough patches diminish. Your skin feels refined. Second, A's brighten your complexion. That dull, lifeless look often comes from accumulated dead cells blocking light reflection. Remove those cells and your skin immediately looks more radiant, more luminous, more alive. Third, Oz can help fade dark spots and hyperpigmentation. By encouraging cell turnover, they help fade areas of excess pigmentation more quickly, leading to a more even tone over time. Fourth, AHAs can reduce the appearance of fine lines. While they won't eliminate deep wrinkles, regular use can soften fine lines by promoting cell renewal and improving skin texture. Fifth, AHAs enhance product absorption. When you remove that layer of dead cells, other products can penetrate more effectively. Your serums, moisturizers, and treatments work better on freshly exfoliated skin. Different AHAs have different strengths and characteristics. Glycolic acid has the smallest molecular size, allowing it to penetrate most deeply. This makes it very effective, but also potentially more irritating. Lactic acid is gentler while still being effective, and it also has humectant properties that help hydrate. Mandelic acid has the largest molecular size, making it the gentlest option, perfect for sensitive skin or beginners. Now let's talk about BHAs. beta-hydroxy acids. The main BHA used in skincare is salicylic acid. Unlike AHAs, which are water-soluble, salicylic acid is oil-soluble. This single difference makes it work very differently from AHAs and gives it unique benefits. Because salicylic acid is oil-soluble, it can penetrate into your pores, which are filled with sebum, oil. This makes it exceptionally effective for treating and preventing clogged pores, blackheads, and acne. It's like having a tiny cleaning crew that can work inside your pores, not just on the surface. Salicylic acid works by dissolving the debris that clogs pores, dead skin cells, excess sebum, and other buildup. It gently clears out pores from within, preventing and treating blackheads, whiteheads, and acne. Beyond its pore-clearing abilities, salicylic acid also has anti-inflammatory properties. This makes it doubly effective for acne-prone skin. It both treats the clogging that causes breakouts and reduces the inflammation that comes with them. Salicylic acid also exfoliates the surface of your skin, similar to AHAs, improving texture and brightness. However, its real superpower is that deep pore penetration. So how do you choose between AHAs and BHAs? If your main concerns are dullness, rough texture, fine lines, or hyperpigmentation, AHAs are your best choice. They work on the surface to brighten, smooth, and even your skin tone. If your main concerns are clogged pores, blackheads, whiteheads, or acne, BHAs are ideal. Their oil-soluble nature allows them to work inside pores where the problems originate. If you have combination concerns, perhaps some dullness plus some clogged pores, you might benefit from using both, though not necessarily at the same time. Now, let's talk about how to use AHAs and BHAs safely and effectively. Start slowly. If you're new to chemical exfoliation, your skin needs time to adjust. Begin with a low concentration, 5% glycolic acid or 0.5–1% salicylic acid, and use it just once or twice a week. Pay attention to how your skin responds. Some tingling is normal when you first apply acids, especially AHAs, but there should be no burning, no severe stinging, no lasting redness. If you experience these, the product is too strong or you're using it too frequently. Gradually increase frequency as your skin builds tolerance. You might eventually use acids 3 to 4 times per week, or even daily depending on your skin's resilience and needs. But this takes time, weeks or months of gradual introduction. Choose the right format for your needs. Chemical exfoliants come in various forms: toners, serums, peels, and pads. Daily toners have lower concentrations for regular use. Peels have higher concentrations for occasional intensive treatment. Start with lower concentration daily products before attempting peels. Apply acids to clean, dry skin. Water can dilute them and reduce their effectiveness. After cleansing, wait a few minutes for your skin to dry completely, then apply your acid product. Wait before applying other products. Acids work best at a specific pH level. Give them 10 to 15 minutes to work before applying other products. This wait time isn't mandatory, but it optimizes results. Always follow with moisturizer. Acids can be drying, so proper moisturization after use is essential. This replaces any moisture lost and supports your skin barrier. Use sunscreen diligently. AHAs increase sun sensitivity by removing that protective layer of dead cells. You should always use sunscreen, but it's especially crucial when using AHAs. Apply SPF 30 or higher every morning. BHAs also increase sun sensitivity, though to a lesser degree. Don't over-exfoliate. More is not better with acids. Overexfoliation leads to irritation, redness, increased sensitivity, and a damaged barrier. If your skin feels raw, looks shiny, burns when you apply products, or becomes excessively sensitive, you're overexfoliating. Pull back immediately. Signs of proper exfoliation include smoother texture, brighter appearance, easier product absorption, and comfortable skin. Signs of overexfoliation include redness, burning, excessive sensitivity, shiny or tight skin, and increased breakouts. Be cautious about combining acids with other active ingredients. Acids plus retinol, acids plus vitamin C, acids plus more acids. These combinations can be extremely potent. If you use multiple actives, consider alternating them on different days rather than layering them all at once. Who should avoid acids? If you have very sensitive skin, active eczema, rosacea flare-ups, or severely compromised skin barrier, acids may be too irritating. If you're on certain medications like Accutane, check with your dermatologist before using acids. Pregnancy and breastfeeding. Most AHAs are considered safe in moderate concentrations. Salicylic acid in leave-on products should be used cautiously and only in low concentrations, 2% or less. Always consult your healthcare provider. Let's discuss results in patients. Chemical exfoliation doesn't produce overnight miracles. You'll likely notice immediate smoothness after your first use, but significant improvements in texture, brightness, and clarity take time. Give it 4-6 weeks of consistent use before evaluating whether it's working for you. Some people experience initial purging when starting acids, especially BHAs. Purging means existing clogs surface more quickly, causing temporary breakouts. This is normal and usually resolves within a few weeks. If breakouts persist beyond 6 to 8 weeks, it's probably not purging but an actual negative reaction. Storage matters with acids. Keep them in cool, dark places. Some acids, particularly vitamin C combined with acids, can oxidize when exposed to light and air. As we close, remember that chemical exfoliation is a powerful tool for healthier, more radiant skin. Used wisely with patience and respect for your skin's needs, AHAs and BHAs can transform your complexion. But they require responsibility. These aren't products to use carelessly or aggressively. They're potent ingredients that demand understanding, patience, and proper sun protection. Take a deep breath in and release it slowly. Consider whether chemical exfoliation might benefit your skin, and if so, commit to using it thoughtfully and safely. May your skin be bright, smooth, and healthy. May you approach powerful ingredients with wisdom and care. May you find balance in your skincare routine. Thank you for this time together. Be well and be gentle with yourself. Welcome to this calm, peaceful space. Take a moment to breathe deeply. Today we're going to talk about retinol, perhaps the most powerful anti-aging ingredient in skincare. Retinol has a reputation. Some people swear by it. Others are intimidated. The truth lies in between. Retinol is incredibly effective when used correctly, but it requires respect and patience. Let's begin by understanding what retinol is. Retinol is a form of vitamin A. It's part of a family called retinoids. When you apply retinol to your skin, it converts into retinoic acid, the active form your skin cells can use. What makes retinol special is its ability to communicate with skin cells, telling them to behave like younger, healthier cells. Retinol increases cell turnover. Your skin sheds old cells and generates new ones, but this slows with age. Retinol speeds it up, revealing fresher, brighter skin. Second, retinol stimulates collagen production.
Dễ thương vậy. Cũng nhiều á.
Nhiều lắm. Rồi đi nặng mấy lần cũng đỡ đỡ chứ hổm thường thấy ghê hơn nữa. Bự bự xong rồi. Nó để mẹ đi học về mẹ lấy cho con vậy thôi. Hồi trước nó cho nặng, giờ nó không cho nặng nữa, nó nặng hơn mặt nó hết. Đau đi.
Không.
Quen rồi đau thử
Ừ.
mà mẹ nặng mấy một đau.
Lát nữa em gửi cho coi. Lát nữa làm sao á, gửi cho coi. Rồi từ từ thưởng thức.
Về để dành coi.
Coi chất lượng của cái mụn đây như thế nào ha.
Không chịu đi nữa đó. Nói ở trên đây. Nói trên đây lấy ngon là rẻ nữa. Ở dưới mình lấy mắt hết ra nữa. Nói thì rẻ mà đưa gì thì mắc còn hết tôi rẻ thì hết. Mặt mày hay cả tiếng mà học như sao cũng ở đây làm chết chứ.
Ừ, đúng rồi đó.
Để hàm nó chán nhiều.
Lấy cục nào xứng đáng cục nấy.
Tự lo rồi định.
Hai mẹ con đi từ đó qua đây là hết bao nhiêu phút chị?
4-5 phút.
Cái này là cho coi trực tiếp luôn.
Trời ơi, đưa lên cái này một đồng nó cái đá luôn. Cái gần. Nuốt đi.
Nữa.
Nhiều quá trời nè.
Bà luôn. Tính cuối tuần mới đi. Em ơi còn bữa nào nghỉ bữa nữa đi bạn ơi.
Không, bên em nghỉ lễ 3 ngày mà. 3 ngày chứ.
Để nó đi học nè.
Học lớp 11 hả em?
Yeah.
Bạn là múc tiền kia ta đưa đi nữa. Này phải đi mấy lần á.
Ừ, cô mua cái gì cũng nhiều á.
Nhiều á. Rồi, nào làm nước đi chị nha. Chứ mặt nó đợi tiếng hồ chưa làm hết nữa. Cô cái chán đã. Chán như ẩn đó từ ẩn.
Ừ. Như sao đây? Nhiều lắm em ạ. Chân mài nó cũng khó em ơi. Chân mài nè, dọc cái chân mài quá trời mụn luôn. Cơm chưa Thư? Okay. Không có xài chung nên yên tâm. Ráng cố gắng một xíu đi cô lấy nhanh nha, mau hết mụn nha con.
Dạ. Cô đứng vậy chứ cô không thấy gì đâu. Mắt cô kém lắm.
Dạ.
Dạ coi.
Đây cũng có đây nè. Con cố gắng lên nha. Con năm nay làm lớp mấy?
Dạ, chuẩn bị ăn lớp 9.
Chuẩn bị lên lớp 9 hả?
Dạ.
Chịu được không con?
Dạ, đau.
Ráng đi. Giờ biết sao giờ? Mụn ẩn nhiều quá hả Thủy hả?
Dạ, rất là nhiều luôn. Nội thấy không? Bà nội thấy không?
Không thấy đâu. Dí sát mặt vô mới thấy.
Dán đi con. Dán đi, cô lấy cho nó hết. Nên chỉ thấy bà nội coi điện thoại dí sát là hiểu như thế nào rồi. Mụn này chắc lâu rồi đúng không con?
Dạ.
À.
Dạ.
cho bé Ngọc đi nặng mụn. Quá trời ơi, cho bé Ngọc đi vô spa nặng mụn. Đang nhiều khủng khiếp luôn mà nổi mụn luôn. Tại mụn ẩn bây giờ phải nặng thôi chứ bây giờ nó đầy hết rồi, ghê hết rồi. Gọi điện thoại về là để xin tài trợ nha. Rồi vậy thôi ha.
Cô mới lấy một đốm chỗ này thôi nha bé.
Dạ.
Ý là cô mới lấy một cái đốm chỗ này thôi mà rất là nhiều luôn rồi á. Con cố gắng lên chút. Cô lấy nhẹ nhàng hết sức ha. Con cố gắng lên chút.
Alo. Cái hàng đó để qua thứ hai rồi hãy giao ha.
Rồi nhiêu đây con?
Biết rồi. Ở cái này nè, đang cho bé Ngọc đi nặng mụn. Đang cho bé Ngọc đi nặng mụn. Không có đâu, ghê lắm luôn á. Bữa nay anh không ngờ anh. Thôi. Sầm từ hết rồi. Quá trời, nổi mũ lên đầy mặt hết mà sao hết rồi.
Cái này không phải mụn nha.
Rồi biết rồi. Có hỏi chỗ cho nó học rồi. Cho rồi. Khó giống như là bước lên nó 7-8 bậc thang chứ không phải bước một bậc đó. Đúng rồi. Rồi biết rồi. Ông nhưng mà chắc bé Ngọc nó chọn văn lịch sử quá à. Chứ chắc cái kia nó học không nổi quá.
Đã đau.
Chán cố gắng chút à. Làm bên trán nó hơi không được thoải mái thôi. Bằng ở dưới cố gắng xíu ha.
Dạ.
Dán xíu, dán cố gắng xíu nha con.
Cái này nặng trong bao lâu con?
10 phút nữa là xong. Lần đầu tiên con đi đó vậy tại con để nó nhiều quá con thấy không? Rồi nó bị viêm, nó lên mũ nhiều nữa. Chứ mấy lần sau con đi là đã ít rồi. Mũ không à. Mấy lần sau con đi nó còn mấy cục nữa. Lâu đâu mình lên.
Mới ăn rau rồi vô không chịu, ăn thịt không à.
Dạ.
Thích ăn thịt không à.
Ra uống nước nhiều không con? Bà thương thì bà mới nói. Này mũ không này hết chưa?
Ngoan lắm, học giỏi lắm.
Vậy hả?
Ừ.
Ủa, đi học là tên Ngọc hả?
Không, nó tên Ngọc An, nhưng mà ở nhà tại nhiều đứa tên sao cái năm nó đẻ ra đó, cái bên nhà mẹ nó đặt tên An nhiều quá, cái đứa nào mà tên thì kêu bằng chữ lót không à.
À. Tên An mà đi học là đầu sổ đó.
Dạ đúng rồi.
Có bị coi kêu trả bài nhiều không bé?
Dạ có.
Với lại con bớt khó chịu lại đi, con đỡ nặng bụng con khó chịu quá, bụng ra nhiều lắm. Hít thở đi con.
Ừ. Vậy chứ sắp xong rồi đây. Mấy phút nữa thôi, ráng cố gắng nha An.
Dạ.
An vậy chứ ngoan lắm nha. Giỏi đó chứ. Mới lần đầu lấy mụn như vậy là giỏi lắm rồi đó bà nội ạ. Thiệt. Có nhiều bạn không có được như vậy đâu. Hai bà cháu đi từ đó lên đây hết bao nhiêu phút?
Chắc lâu rồi thì cô chạy chậm.
Tại lúc gọi cho em là cũng buổi sáng à.
Ừ. Thì lúc đó con bé này mà nó dậy sớm là lên sớm rồi, nó dậy trễ quá.
Nghỉ hè mà cho cháu nó ngủ nướng một tí. Sáng nay ăn nha. Chứ lúc đi học là phải dậy sớm rồi. Chừng nào đi học lại con gái?
Dạ con chưa có biết. À.
Đoán là con gái.
Thủy giải quyết mấy cái mụn viêm ha Thủy.
Dạ, giải quyết hết rồi đó cô. Bây giờ lấy mụn ẩn đây. Con làm nhanh lắm. Chứ làm lâu nó đau, đâu chịu được.
Coi mấy cái clip nó có nhiều người bị, trời sao mà bị nhiều dữ vậy không biết. Chắc tại cái cơ thể sao nó sinh ra chứ.
Dạ, với lại để lâu quá nó bị viêm nặng hơn rồi đó. Nó lan ra hết mặt rồi á. Bị ít mình lo mình đi á, nó không bị lan.
Lúc nó bị là nó còn đi học nên cô không có đưa nó đi được.
Dạ.
Thì bữa nay cái nó lại gần để cho bà nội dòm thử con coi. Dòm cái này đó, cô mới dòm nó từ đầu tuần đó. Chứ bình thường cô không có thấy, là cô ít thấy đó.
Đem cái đàn ra cô lấy mụn cho mà hết nha.
Lỗ mũi nó có mấy cái mụn đen mà lâu năm rồi đó Thủy, nặng ra không?
Con thử xử hết, yên tâm. Ra hết á. Miễn là mụn có nhân là con xử hết.
Cô coi trên clip nó có cái phần cái cô đó cô bình luận hay á, là ở thành phố Hồ Chí Minh là có Thủy Trương, ở Hoàng Huế là có Loan Nguyễn,
Đà Nẵng cô ạ.
Đà Nẵng là thì đó là nặng mà sạch sẽ đó. Có nhiều người nặng cô thấy bầy hầy quá, nặng phủi là cô không thích, cô không coi. Cái clip mà con nặng cho cái cậu mà cái thằng bé ở Đài Loan về đó.
Dạ.
Tội nghiệp quá con ha. Chắc đau dữ ha.
Nó viêm để lâu từ mụn ẩn mà để lâu quá nó Nó đi đúng cái chỗ mà nó làm không có uy tín đó cô. Cái nó đè xuống nhỏ bị viêm hơn, nặng hơn. Rồi, nhìn qua cô thấy coi cái mũi thế nào. Sắp xong rồi con, sắp xong. Cô kiểm tra lại cái nữa là xong rồi. Nhìn qua đây cô coi thử. Nhìn qua.